We always begin by washing our hands. We then introduce ourselves and explain to the patient what we will be doing. Hi, my name is Paulo. I'm going to be your student physical therapist. We're going to do a couple things today. We're going to start out just by asking you some questions, then we're going to go on and do some tests, listening to your heart and lungs, all right? Okay. After explaining the process, we then begin the actual interview. My name is Paulo. I'm going to be your student physical therapist today. Can you just confirm your name and date of birth for me, please?
Talia Brennan, 11/03/1995.
All right, nice to meet you, Talia. Now, what brings you to physical therapy today?
Well, I have a lot of back pain right now.
Back pain? Is it upper back, lower back, your whole back? Lower back. Now, how did this happen?
So I actually dropped my pencil when I went to go pick it up, and then I did a bend and snap.
Bend and snap?
And that's what really threw it off.
The snap really
it just got me.
Man, and how long ago was this?
It was about a week ago.
About a week ago.
Yeah.
And so on a scale of 0 to 10, 0 being no pain, 10 being the worst pain imaginable, right now, what would that pain be?
I would say about a 6.
About a 6 right now. And at its worst?
About an 8.
About an 8 at its worst, and at its best?
The best it's been is about a 5.
About a 5.
Mm-hmm.
So what do you do that kind of irritates your back the most to bring it to that 8 level?
Mainly just bend over. So if I'm, bending over to get pots and pans out of the cabinets, that really irritates it, or just bending over in general, like yeah.
All right, and what do you do that kind of brings it back down to that lower level of pain?
I'll just ice it, but it only helps a little bit, and then sometimes I'll just take an aspirin.
Ice and some aspirin. And how long does it take to get back to that level?
Probably about an hour.
Maybe an hour. Now, how would you describe the pain?
It's a sharp shooting pain.
Sharp shooting pain. And has there been any other symptoms, or just that back pain? You don't feel
really
pain like in your hips?
No, mainly in the back.
Just the lower back?
Yeah.
And since you first started feeling the pain, has it been getting better or worse?
I would say it's kind of stayed the same,
Roughly
but sometimes it'll get worse when I use it.
All right. Are you seeing any other healthcare
Just
professional?
my doctor, but
Just
he's
your
the one
doctor.
that sent me.
He referred you here. All right. Have you had any previous injuries or surgeries that might affect your back?
No surgeries. I have hurt my back before doing the exact same thing. So I dropped my pencil, believe it or not, and bend it and snap.
Bend and snap. Now, how long ago was this?
That was about a year ago.
About a year ago. And what did you do a year ago that kind of helped your back get better
Mainly
again?
just iced it, and it really helped it get better.
But the ice isn't working too well this time?
No,
it's a little worse now?
it's a little worse.
All right. Do you or your family, do you have a history of hypertension, heart diseases, any cancer, strokes?
No, we're pretty
nothing?
healthy.
You're pretty good? And so that back injury, has it affected your ability to do any, tasks in general?
Yeah, so like I said, the pots and pans, and then also just working. So I work as a valet, and getting in and out of cars sometimes, especially if they're lower
cars.
then it hurts it a little bit.
Okay. And do you have any hobbies? Anything you like to do?
Yeah, so I like to walk my dog a lot, and I also like to play tennis. And she kind of yanks me,
and
so
it kind of hurts
it
to do
sparks
those.
up a little bit.
So you're not able to do them, or just a lot less?
Yeah, really a lot less. And tennis too, it hurts me to play. So.
And so, what are you hoping to achieve here in physical therapy?
Well, mainly just to reduce my pain and to be able to start playing tennis again and walking my dog and just working.
Just to be able to function again without feeling that sharp pain?
Exactly.
The medication that you're taking for the pain, you said it was aspirin?
Yeah.
It is. And how much do you take?
About 200 milligrams.
200 milligrams at a
Yeah.
time? And how often do you take that?
Just when it really hurts.
So not like daily, not every morning or something like that?
No.
Okay, and is it helping?
Yeah, it does help a lot.
It does. Is there any side effects that you notice when you take it? And does your doctor know that you take?
Yeah.
He does?
Yeah.
Okay. We end the interview by explaining to the patient the things that we will be doing next. To listen to the heart, we'll be focusing on these four main areas. It is important to explain to the patient what you are doing. This can help with the comfort of the patient, especially when they are more exposed. You should also take into consideration gender issues and always get permission before making any points of contact. To begin, we palpate for the clavicle and move towards the sternum. We go down into the first space, over the second rib, and into the second space. This will be the location of our first sound. The next sound we're looking for is directly to the left on the other side of the sternum. For the next two sounds, we will continue to palpate down to the fifth intercostal space, but don't forget to get permission from the patient to do so. The third sound will be to the left of the sternum, and the last sound will be in that same space, but at the mid-clavicular line. You should explain to the patient the sounds you are listening for, in this case, the lub-dub of the heart. The lub, or S1, is the sound of the tricuspid and mitral valves closing. The dub, or the S2, is the sound of the aortic and pulmonary valves closing. To listen to the sounds of the lungs, we look for these points. Again, it is important to explain to the patient what you will be doing and get consent before making any points of contact. The sounds you are looking for will be anything that isn't a smooth inhale and exhale. You may hear some things like crackles, which sounds just like its name. This can indicate movement of secretions, fibrosis, or atelectasis. Another sound you might hear could be a wheezing sound. This can be related to things like asthma or emphysema. The ABI, or ankle brachial index, can be used to ensure proper circulation of blood to the extremities. Again, it is important to explain to the patient what you will be doing. So what we're going to be doing is taking the ABI, the ankle brachial index, and what we're going to be doing is taking the blood pressures of the arms and the ankles. Let's just put this here. Let's get this on first. If you could lift, thank you. You can put your arm down. Let's get this shirt lifted up just a bit. Is that good or is it tight? Alright. And first thing I'm going to do is find the pulse. Wonderful. So now we just take a little bit of this gel. You know what, Tariq? Can you come over here, please? That way you can record. A little bit of gel. Rest this on check the other arm now. Just move your sleeves up a bit. You can put your arm down. Thank you. Alright, we're going to find that pulse again. Let's put this here so you can see. A little bit of the gel. The ankle, if you could lift your leg for me, please. Thank you. See that. Pulse. Last ankle, this right here. This is the equation used to calculate the ABI. What we were listening for was the pressure when we heard the first sound of blood flow, or the systolic number. These are the numbers that we plug into this equation. For the right arm, the number where I heard the first sound of blood flow was 120. For the right leg, that number was 134. On the left side, the arm, the number I heard it was at 112. And for the left leg, I heard that first sound at 130. So to calculate the ABI for the right side, we're going to take the pressure from that right foot, which is 134, and put it over the highest pressure in both arms, being 120. Now I don't know where I did this math or how I did this math, but that 0.95 is wrong. The correct answer should be 1.12. The same goes when calculating for the left. We'll take the pressure in the left foot and put it over the highest pressure in both arms, this being 130 over 20. Now this comes out to 1.08. We can take the two numbers we just got and compare it to this chart. Her right side being 1.12 and left being 1.08 shows that her ABI is normal because it is greater than that 0.96.
Alright, Paula has met all the requirements for this video. I approve this message too.